Welcome back. Well, giving birth is one of the most intimate, exhilarating and nerve-wracking experiences a woman can endure. Today, more and more are choosing home over hospital as their preferred place of birth. So why is that, and is it safe? A new Australian study suggests giving birth at home is as safe as it is in hospital, a claim that's been slammed by doctors as misleading. That is the topic of today's agenda, and I'm joined now by Professor Caroline Homer, Director for the Centre of Midwifery at the University of Technology, and obstetrician Dr Gino Pecoraro. Good morning to you both.
Good morning.
Good morning.
Gino, if I could start with you. The study found home births had no statistically significant impact on infant mortality. What is your reaction to that statement?
You need to look at the type of study that it was. This is what we call a meta-analysis, where they combine a number of smaller studies together to increase the numbers and hopefully increase the power of it. Now, the problem with this, of course, is that it isn't one study specifically designed to answer a question. It's a type of data dredging where we look at results. The problem with this particular one was that not all the studies looking at home birth outcomes were looked at, because there are at least two that we know of, one done in Australia that actually showed an increase in the mortality or the risk of death if a woman delivered at home, but also it didn't include any of the studies from the United States, which are totally different. The largest study in this one actually looked at delivering practices in the Netherlands. Now, the problem with that is that that's a totally different system, and it's correct, there was no difference in outcome when you look at mortality rates between hospital or home birth. But our results in Australia are much, much better than the Netherlands generally. And it may just be showing you that having a baby in the Netherlands is not as safe as we currently enjoy in Australia.
Caroline, would you like to comment on that and your thoughts on that study?
So that's a study that we've conducted, and we particularly looked at women who were low risk and healthy. So we tried to remove a lot of the studies, and some of the studies that Gino's mentioned, which included women with risk factors. So we're trying to work out across the world, if you are low risk and healthy in a developed country like ours or the Netherlands or the UK, what's your risk in a home, in a hospital or in a birth centre? So meta-analyses have problems because they are bringing all the studies together, but this is adding to the body of knowledge we have that home birth can be safe in the right circumstances with the right people around.
Why do you think more women, let's just focus on Australia, why do you think more women here are choosing to have births at home than a hospital?
Well, giving birth at home can be a really positive experience, and many women are finding that the hospitals are scary places full of strangers who may or may not wander in and out of their rooms, and they might not choose that. And so they want a more homely environment, they want people around them who they know, they might not want to travel in traffic when they're in labour. So there are a raft of reasons why women are choosing home birth. One of the other challenges is that women who've had a poor experience with their last baby in hospital go looking for a better option next time, and sometimes that's at home.
Gino, for perhaps pregnant women watching this and are weighing up both options and are not quite sure, what would you say to them?
Make sure that, first of all, you get all the accurate information and it's delivered in a way that it means something to you. When health professionals start talking about meta-analyses and statistical significance, it can actually be quite confronting and confusing. But relative risk is a concept that's hard to get across. If something happens to you, it's 100%, and being told, look, the chance of something bad happening is low, doesn't actually mean that much. I think a lot of what Caroline said displays that we can do better in our hospitals, absolutely. And for anyone who is considering not having the baby in a normal hospital, perhaps they need to look at finding a hospital that's more akin to a home-like situation near them, but that has all the available equipment, all the available staff. If you're in a home birth, you may only have one midwife or another midwife helping her. And as Caroline said, traffic is a real issue. Getting across town in Brisbane, Sydney or Melbourne, major capital cities, it took me 40 minutes this morning to come from an inner city suburb in Brisbane to Mount Cootha, which is really only about 10, 15 kilometres away. If something goes wrong in obstetrics, you can go from totally normal to totally life-threatening for both people involved in a very short period of time. And facing Sydney traffic when you've got a woman bleeding is just terrifying and unnecessary if we can make hospitals nicer places for women to deliver.
That probably makes a lot of sense, Caroline, you know, for people who perhaps don't want to do the full home birthing option, but we could look, couldn't we, surely, at making our hospitals have more of a home-like environment?
Yeah, so one of the other models of care we looked in at that study were birth centres, either co-located next to a hospital or a bit far away from the hospital. The important thing that women want is to know the midwife who's going to be there at their birth. They don't want strangers with them when they're at the most vulnerable time or the most exhilarating time of their lives. So we need to make continuity of midwifery care absolutely standard in every hospital, in every birth centre and at home, so that women can choose the best model that's for them and the safest model that's for them.
Makes a lot of sense. Caroline Homer, thank you so much for your time. And Gino, always good to talk to you. Thank you so much.
Thank you.